In this video, we will show you how to care for and feed a cat via an oesophagostomy feeding tube in the veterinary clinic or at home. Prepare materials before you begin. You will need appropriate food, warmed to body temperature and drawn into syringes, an empty 5ml syringe, a syringe of water to flush the tube, and equipment to clean and redress the tube. Whenever we are dealing with the feeding tube, ensure the cat is comfortable, perhaps sat on a caregiver's lap or in a bed or on a blanket. Having someone to help you is helpful. If the cat tends to move, then they can be put into their carrier during feeding. Try and make this a positive experience with lots of stroking if the cat enjoys this, kind words and gentle handling, or even a treat if they are allowed and can eat orally. If possible, rest the cat's head on a blanket to elevate it slightly. With clean and dry hands or wearing gloves, we can check and clean the feeding tube. First, remove the dressing or collar. Check the site where the feeding tube inserts into the cat's skin. The tube may have a mark or measurement indicating it is in the correct position as it exits the skin. Check the stitches holding the tube remain in position and that the area is not red or swollen. A small amount of discharge can be normal, but if you see any food, pus or blood, contact your veterinary clinic. It can be helpful to take a photograph to show them. With clean and dry hands, preferably with gloves, the skin around the tube can be cleaned with a swab and a disinfectant safe for cats. Gently remove any discharge. Avoid making the area or the cat's fur too damp or rubbing too hard and making it sore. You can dry the area with a clean swab. Once clean and dry, the dressing can be replaced. Types of dressing can vary. Sometimes an antibacterial disc may be placed around the tube insertion site. For some cats, a fabric collar is suitable. Check the collar or bandage is not too tight by ensuring you can fit 2 fingers between the dressing or collar and the cat's neck. To feed a cat via an oesophagostomy tube, start by uncoiling the tube from the dressing or collar with clean hands. Pinch the tube to seal it when you remove the stopper to avoid any leaks. To check the tube remains in the right position, attach an empty syringe to the tube and pull back. Negative pressure should be achieved. If it is not, or fluid comes back, contact your veterinary clinic. Next, slowly flush 2 to 5 ml of clean water into the tube, checking the cat remains comfortable and does not cough or retch. Contact your veterinary clinic if you are concerned. If you are happy with these checks, then attach the tube of liquid or liquidized food, warmed to body temperature and well mixed. Medications can also be given via the tube if crushed and mixed with food or water. Food should be administered slowly and steadily and should not cause the cat any discomfort. When feeding or administering medications, watch the cat for signs of nausea such as retching, gagging, drooling, or becoming restless. Feed slowly and provide positive attention by stroking and quietly talking to the cat if the cat is receptive to this. After feeding, flush the tube with 2 to 5 ml of clean water to ensure that food and medications have passed out of the tube. Pinch the tube closed and replace the stopper. Water may remain in the tube and this is not a concern. Secure the tube back into the dressing or collar and again watch for signs of discomfort or nausea and contact your veterinary clinic if you are concerned. After feeding, leave the cat to rest quietly.